Sab Isa. I'm a social worker, consultant, and a long-term advocate for cultural brokers. I have been leading a nationwide monthly support group for cultural brokers over the past 5 years. Some of them are on today's call co-presenting and made a huge contribution to this webinar. I'm very grateful for their partnership, and now I'll pass it over to my co-presenter, Bijou, to begin.
Hello, everyone. My name is Bijou Bahati. I work for Jewish Family Services of Western New York, based in Buffalo. My current role as of last week is a program manager for our trauma systems therapy for refugees, which has been in implementation for just over a year. I was first hired as a cultural broker and went on to be a lead cultural broker. I'm a former refugee and child of an immigrant from Democratic Republic of the Congo. Professionally, I'm new to cultural brokering, but it is not new territory for me and many in this role, for we've all survived, navigating systems. And I thank you today for joining us, and I look forward to the conversation. And I'll pass it on to Alicia, our co-presenter.
Thank you, Bijou. Thank you, Osab. So my name's Alicia Miller, and I'm so excited to see so many of us here for this conversation. It's so important. My pronouns are she, her, hers. I'm a clinical psychologist by education, and I'm licensed here in Massachusetts. I'm also a core member of the TCRC that's hosting today. I've dedicated a majority of my professional career to raising the standard of care for refugee and immigrant youth and families, part of which has been by being an integral member of the model development team for trauma systems therapy for refugees, particularly thinking about the role of cultural broker in that model. And also I have worked tremendously to develop resources to help providers who really want to work with refugee and immigrants to ensure that they're able to give trauma-informed and culturally responsive care. So I'm excited to continue the conversation today. Okay, so to start with, we, the presenters, have absolutely no disclosures to report at this time. And to get us into the lay of the land of who's in the room with us today, we have five questions that we'd like to ask. So we're asking everybody to participate in a poll. So Amy, can you bring up the first question? All right, the first question is, have you worked with an interpreter in a therapy session? Please answer yes or no.
Okay, we have lots of people answering. I love this. Get a few more clicks. That'll get us up to 75%. Wonderful. Here we go.
Oh, great. So we're just about 50-50 with a little more than half of us having worked with an interpreter before. That's wonderful news. So that gives us some insight into what's happening. And so we'll move to our second question. And our second question is, have you worked as an interpreter in a therapy session?
Okay, awesome. I'm going to end the poll and I'll share the results.
Oh, okay. So we have 20% have worked as an interpreter. That's super exciting. We're about 100 people, so that's about 20 of us in the room have been an interpreter, and 80% have not been an interpreter. Thank you, everyone. All right, can you bring up the third question?
Mm-hmm.
Okay, the third question is, are you familiar with the term cultural broker? I know we've mentioned it already a couple times, but are you just knowing the word, but are you familiar with that term and what that means?
Oh my gosh, so many people answering. I love it. I'll give it one more minute. Okay. Go.
All right. Wow. Super exciting. This is like really heartening to me that 77% of us have heard of the term cultural broker, and 23 have not. So this is going to really provide for such a rich discussion today. I'm excited about that. All right. And the fourth question is, have you worked as a cultural broker in a therapy session?
Okay. Give it a couple more seconds. Everyone's very active today. I love this.
It was the song, I think. The music
Great.
got us going. All right. So have you ever worked with a cultural broker? So a majority of us have not worked with a cultural broker. So even though 74% of us have heard of it, 74% of us have not worked with a cultural broker. Thank you. All right. And I believe this is our last question. Have you ever worked as a cultural broker in a therapy session?
Okay. Give it a few more seconds. Okay.
All right. So by and large, a majority of us have not worked as a cultural broker, but 15% have, and that's super exciting. We hope that everything that we talk about today, we have a kind of a wide range of experience, some of us being interpreters, cultural brokers, being clinicians, maybe not being clinicians, right? But really kind of open to hearing about this experience, which is so wonderful. So thank you everybody for your participation. All right, so today, by the end of our presentation, we really hope to define the difference between an interpreter and a cultural broker, highlight the experiences of cultural brokers working to implement trauma systems therapy for refugees across the nation, name best practices for interpreter, cultural broker, clinician partnerships, and then finally to explore ways to contribute to a better system of care for ourselves, our colleagues, and ultimately our clients. All right, so before we kind of launch into the content, I want to share with you a public service announcement that was developed by Pacific Interpreters. So I am going to stop sharing for 1 second and then I will be right back. All right.
Doctor on Albertillo. That's Tandoro.
Excuse me, sir. I'm so sorry.
Attendi,
She's been crying nonstop. She has a temperature of 105. I don't know what to do.
Maravidig. Vi paroles
No,
lasant.
please. Just every time I feed her, she throws up. I don't know.
Vi
I
paroles
don't understand what you're
lasant.
saying. What are you saying? Can you just look at her? No, she's burning up. Just feel.
Faju paroles la anglan.
No, what? She's burning up. Feel her head.
Tranquilli kananje. The Monday is Askan.
What is he doing?
Do you have?
My baby, she's got a temperature of 105. Every time I feed her, she throws up. Please, just, can you? She's burning up. Feel her head.
Morapidig.
Please, just feel her head. Feel her head. Just someone let me in to see the doctor. No, does anyone understand what I'm saying? Please, someone help me.
8% of U.S. citizens speak limited English. For these 25 million Americans, professional interpreters can mean the difference between life and death.
Great. I just want to say thank you to Pacific Interpreters for really creating a public service announcement that kind of viscerally brings us to that space for understanding how important language access is, right? Language interpretation services improve patient outcomes and also saves lives. So now that we're deep in there in that powerful message, I'm going to be sharing. I will go back into the slide deck. All right. That was powerful, right? Okay. So let's talk about interpreters for a minute. I'm going to spend just a little bit of time here at the beginning to talk about interpreters, and then we're going to switch it over to cultural brokering. So first of all, interpreters, as many of us probably know on the meeting today, is a recognized role in the United States healthcare system. And despite the critical role that interpreters have in the provision of child mental health services, they often don't receive specialized training in working with children, individuals or families who have experienced trauma, nor do they really receive training on how to partner with mental health clinicians. And the same is true for mental health clinicians. Oftentimes, they do not receive training on how to collaborate and partner with interpreters. It's a clear gap. And so we hope to connect some of those pieces here today. Interpreters are professionally trained. They serve as verbal connectors between people who need to communicate but do not speak the same language. An interpreter's job is to relay what is said in a conversation by interpreting each speaker's message to the other person. So typically, the interpreter will simply take the words from one language and interpret them into the other language. The two fundamental aspects of interpreting are to facilitate the understanding in communication between people who are speaking different languages. So the interpreter serves as a bridge between the speakers, making communication possible. In acting as this connector, the interpreter allows healthcare access to a person who may not have access otherwise. In addition, a fundamental role is for the interpreter, they must convey information accurately. So this is particularly important in a mental health setting because miscommunications can lead to misdiagnosis. Misdiagnosis can lead to inadequate treatment planning. So there are four modes of interpretation. The first is consecutive interpretation, and that's the most common. So this is when an interpreter remains silent while one speaker is talking, and then afterwards there's a pause, and that interpreter then relays the information. This goes back and forth where there's like a first speaker, a pause, and then interpretation back and forth throughout the interpretation session. During simultaneous interpretation, the interpreter relays the speaker's message while the speaker is speaking, following only a few words behind. And this is a very fast-paced interpretation. You need a lot of skill to do this, but it's often used when you're interpreting for one or more people in a group, and it's more about a situation, not directly with a client. Another mode of interpretation is sight translation, and this is where an interpreter would be asked to read a document like a consent form or prescription directions for prescriptions in one language and then read them aloud in another. The last one is summarization, and this is what happens when, with the speaker's agreement, an interpreter might summarize everything that's being said after a long period of speaking. And the interpreter would just summarize the important points that were brought up during that time. So quality interpretation services is essential and provides the following benefits. And this is from what the research has shown. Interpretation really allows us to meet the needs of a larger pool of community members so we can reach more people in our community. it is able to provide higher quality assessment and a more accurate diagnosis. There's oftentimes higher levels of engagement with children and families and less attrition from services. And it's been shown to have improved adherence to medication schedules. So people are more prone to be taking their medications as they're supposed to. It's been shown to improve access to care and also quality of care, which is important. And then also been shown to improve the ability to understand recommendations that are made for therapy and treatment altogether. And importantly, for you management folks out there, it has been shown to be cost effective. Very important. So there's a lot of times there's ad hoc interpretation. People talk about this quite a bit. And what that refers to is when interpretation is done by a person who is not trained to be an interpreter, but happens to speak two languages that are needed for that interaction. For example, like if a bilingual receptionist, nurse, or family member may be asked to interpret if a trained interpreter is not available. And sometimes this happens with children. By and large, ad hoc interpretation is not recommended, and it can be problematic for many reasons, for a variety of reasons. For example, the interpretation may not be efficient because there is a lack of fluency in either or both of the languages. There might be difficulties that are created due to complex terminology that are used in the mental health or health settings that lead to more likely to make errors, violate confidentiality, and increase risk of poor outcomes such as misdiagnoses. In addition, if you're just pulling somebody in, they may lack the knowledge of ethical and legal guidelines in that interaction. Importantly, when family members are often kind of brought in to serve as interpreters in a pinch. However, we believe that using them is unwise because of the difficulty they might have in remaining neutral. Although a family member may have the best intentions and often do have the best intentions, it could be that upsetting or embarrassing information shared in a serious mental health or medical situation can lead to difficulties for family members to serve as an interpreter. Emotions can easily cloud thinking, and this doesn't make great for accurate or useful interpretation. Children and teens sometimes are asked to translate for a caregiver, and this is also suboptimal as well for a variety of reasons, including the child may be exposed to adult matters like financial hardship, parental conflict, that might cause them distress and from which adults ordinarily would shelter them. And then additionally, putting children and teens in a powerful position of gatekeeping information that they share could really undermine a caregiver's authority and decrease the power of a caregiver. So we have some best practices just when meeting with families. We believe that a mental health clinician and interpreter should meet and agree on 3 different opportunities to connect and partner before, during, and after a meeting. Beforehand, you really want to make sure that you're attending, that everybody is present and attending to the different relationships in the room. So the clinician, the interpreter or cultural broker, and the client, and that you want to make time to discuss the hopes and expectations for the meeting, have a clear understanding of what those are. During the meeting, you want to be able to rely on verbal and nonverbal communication that's happening. And the interpreter and cultural broker have a keen eye for that. And then keep in mind the therapeutic triad, which I'll review in a minute. And then after any sort of interaction, we would really encourage people to discuss each other's understanding of what happened. So really kind of debriefing the interaction, clarifying any areas of confusion or disconnect of understanding, and then follow up with questions regarding cultural context and what may be happening. So here's the therapeutic triad that I just mentioned, and this is a little bit different. Sometimes when you bring in a professional interpreter or cultural broker into a therapy session, this can be an unfamiliar idea to mental health clinicians because it alters the from a dyad to a triad, the therapeutic relationship. And so the therapeutic triangle is nice because it really acknowledges the expertise of each of the participants in the room as essential to the therapeutic process. So the clinician holds particular expertise on issues related to mental health, like psychological consequences of trauma and strategies for healing. The client is an expert on their experience in their own cultural, linguistic, and political context. And the interpreter or cultural broker is really the conduit for that communication and an expert in language, both verbal and nonverbal, between the client and the clinician. So really the interpreter and the culture broker hold a lot of power in this situation because they are understanding both. So this relationship is key to the therapeutic alliance. And as much as possible, we want interpreters, cultural brokers, and mental health clinicians to share power and to collaborate together. And so on that note, I will turn it over to my colleague, Osa.
Thank you, Alicia. While some of you might have worked with interpreters or are familiar with the benefits of having one, in the following slides, I will go over several ways on how the role of cultural brokers are different. Number one, cultural brokers bridge the gap between the community and the providers by mediating cross-cultural difference, deepening understanding of cultural values, community dynamics, and clinical services. Two, they share similar background as their clients, cultural beliefs, values, customs, and the knowledge of the migration experience, which I think is very important, as well as raising awareness within community about mental health and various service systems, because their understanding of the Western culture and they understand the Western culture and how systems work. And third, cultural brokers add contextual cultural information, facilitate deeper understanding of cultural clients' world value. This can include translating nonverbal communication, taking the time to explain cultural customs to a clinician prior to clinical encounter. Although cultural brokers have been around for a long time, their role has not been recognized within the US healthcare system. But I'm personally hopeful because we know changes has happened in this country a lot faster than some of us had expected. Some, I should say. Next, please. The complexity of the role varies, but at the core, it involves bridging cultural gaps. So cultural brokers listen to acculturation issues the client and families are experiencing. They validate these concerns, co-create solutions, because a lot of them share the same socio-economical barriers as their clients, and they understand cultural gaps better than anyone else. Mediating and negotiating, navigating complex processes within the organization and communities. Cultural brokers might have extensive experience and might be appointed by communities. Cultural brokers have the opportunity to make change in organizations by advocating and lifting community voices, transforming delivery of services. I also wanted to say that organization challenges is too big for a task for one person. So we all need to work together in order to meet goals and expectations. Often some cultural brokers have experience working in money healthcare systems and have a lot to offer. And I think that's why communities have a lot of respect and turns to them as either gatekeepers or advisors. Truly, they are kind of answers to a lot of problems or offer answers to a lot of problems. Next slide, please. Pass it to Bijou this time.
As you may already heard, so cultural brokers wear multiple roles, or multiple hats, I should say. At the basic level, cultural brokers are intermediaries. They are the in-between people, or middle person or middleman, bridging the cultural gap, and more specifically, communicating similarities and differences between cultures. Cultural brokers are mediators, negotiating complex processes within organizations and communities, more like peacekeepers, especially in navigating issues around distrust. Cultural brokers play a critical role in establishing and maintaining trust, which is a foundation for building meaningful relationships. Cultural brokers become community liaisons, for they have successfully navigated systems of care for themselves or for their families. It is as if they speak the language of their community at the same time the system of care that they work in. Cultural brokers advocate on behalf of clients and provide, they can be cultural guide and also to increase understanding. What differentiates cultural brokers from interpreters is that cultural brokers are cultural interpreters. We know that language is influenced by cultural values, beliefs, and practices. Simply relying on language to unpack the meaning of what is being communicated is not sufficient. Cultural brokering, in this sense, is about navigating the nuances of cultures. Next slide, please. I'll pass it to you.
Thank you. Since the role of cultural brokers is complex, there are core principles that are meant to keep us grounded. There can be some unhealthy divisions within immigrant communities. And these are 5 core principles. And I wanted to say that, again, none of us are perfect. And really the goal of these principles is, again, to be aware of it and to continue practicing and making improvement as you're noticing it's coming up within the work field or when you're doing the work. For example, in immigrant communities, there might be tribal or caste-based difference, right? It's important for cultural brokers to respect and understand and explain the difference within communities. Another issue that sometimes comes up is ethical. Ethics play a major role in everything we do, whether it's a caregiver asking the cultural brokers their advice for medication or deciding to enroll your client in research study. Just like rules and regulations, ethics guide us. And sometimes I say, thank God. For someone who's from third world country, I'm like, thank God those are there. I'll turn to Bijou to kind of provide example, maybe the last 2.
Sure. So as you just heard, there are layers of issues in every community, including bias toward people who may not be from your own culture. For refugees and immigrant communities, tribalism is one of those. And it can be an invisible enemy to building trust. For some, discriminatory behaviors and attitude toward people who are different from them, from whether ethnic group or tribal group. And for some of these groups, it's a historic and generational issue. These principles help cultural brokers to not be lured or tempted into these practices. It helps to stay grounded in their role as professionals and take care of their professional responsibilities. So it is important for services to be provided in a safe, non-judgmental and confidential way. It's also important to consider the fairness of everyone accessing service. This is how we build strong and trusting partnership. Next slide.
Beautiful. The potential benefits of having interpreters, cultural brokers, and commission partnership. First, it allows for effective communication. I think, second, it creates a positive experience for clients. I always say representation matters, and when clients see people that look like them, speak the same language, they can access services much easier. 3, increase community knowledge of clinical services. Think we know that refugee and immigrant communities are often hesitant of getting clinical services because of so many barriers. And I think kind of all of us, partner clinicians, cultural brokers, and interpreters working together to decrease that stigma. And 4th, increase clinical teams' knowledge and understanding of a community. Because of the partnership with all 3, the interpreters, cultural brokers, and the clinical team are learning the issues the communities are experiencing and are going through, because sometimes clinicians might not live in the communities that they serve, right? And vice versa. Cultural brokers could be living, and then 5th, create a sense of collaboration between community and clinical team. I think that this work, providing mental health services, cannot be done alone. We know that, and it only the service only becomes stronger if we model that collaboration for the communities that we serve. Increase engagement and access to services. And lastly, create a community acceptance of the program. I think programs are as only good as the people that are in it, right? If we are practicing all the points that I highlighted above, then it's much easier for families to know what it is, what we do, and seek help. I'll turn to you. Next slide, please. Okay, so you must be wondering, how do you hire cultural brokers? How do you sustain them? And where is the money coming from? Right, all of that. Good questions. First, I wanted to start by saying cultural brokers are typically hired through local mental health agency, providing clinical services to the community. They are what we call them community helpers, community influencers. They are the people that Saturdays and Sundays that they might be in church, they might be at the mosque, they might be really sitting with communities when they're going through difficult moments and guiding community and families on where they should get help and problem solving, whether they're getting paid or not. Another one is really, I think, going beyond traditional recruitment systems. We all know, most of us on this call know that there are traditional systems which we all try, posting a job or HR department, all of that. But I think we need to be a little more creative and think outside of the box. So who are the community members? How are community members being hired? Whether you want to call them cultural brokers or interpreters, but people in the community, what is the plan of hiring them? And is there even a plan, right? Understanding what the barriers are to hiring. Who is the champion on that agency? Who is the champion of community work, right? Somebody cares about community work. And so kind of brainstorming who those individuals are, and are the right people sitting on the table brainstorming the individuals that is getting that's sitting in the HR department, right? Another one is, in terms of identifying cultural brokers, is someone that's really is familiar with mental health care system, and that has done their own homework of not only understanding how systems work, but also overcoming the stigma about mental health and understanding the importance of that. Just like our physical pain matters, and we're the first one to go to a medical doctor when we have a pain, our mental health matters. And I think that person can sit with families and have that conversation. And someone that community goes to. I think I said that, I cannot say it enough, for assistance, whether it's that person works in a local community agency, whether that person is a religious figure, right? We all wear multiple hats, but they're often community goes to a natural person that kind of problem solves the issues with them. And I would say the foundation of cultural brokers, really, if there is one that I have to pick, is someone who communities trusts. That trust foundation, I think it's so important. And someone that community goes to when their young person is in trouble, or when that really are willing to share issues that they don't want to share with anyone else, right? That has built that trust over time with communities and families. And then I also want to take the time of talking about trainings and how do you pay cultural brokers. Many mental health agencies are able to bill state medical plans for cultural brokering services through existing roles, such as caseworkers, case management, community health workers. And then there are aspects of the work that might not be able to cover, such as like community engagement or community outreach activities. And those sometimes are covered through grants, if you're lucky to get a grant. And in terms of a training, there is not a formal trainings that's in place for cultural brokers. Cultural brokers do not have a clinical trainings or graduate degree in a mental health related field, such as psychology or social work. But some of them, when they came to the United States, had to restart over their education. And I won't even get into it, the frustration that people go through when they have to restart their educations. But they have to really restart the education requirements in the United States. Some receive trainings within the institutions. For example, we, the team that does the trauma system therapy consultation, we provide specific trainings related to the model, right? We also provide other trainings of the best practice and collaborating with communities and providers. So I think there's not one unified trainings for cultural brokers. There are a number of cultural brokers that have personally provided consultations and trainings specific to whether it's the TST intervention model or just generally of how do you do this work, right? Next slide, please. And if you have any specific questions in terms of hiring, supporting cultural brokers, please feel free to email us and we can provide a little more information. And then I'll switch the gears for a second and really talk about the monthly cultural brokering call that I lead. Number of cultural brokers are on this meeting, part of this call at the moment, have contributed their voice and shared their experience of doing the work and future recommendations. So I'll turn to my colleague Bijou to begin.
Thank you. So in this next session, we'll be focusing on a few of the challenges that cultural brokers expressed. So we will be bringing that voice into the conversation. First and foremost, many of the cultural brokers expressed, the idea of, or the challenge of working within your own community. And one cultural broker expressed, as a cultural broker, you work with families from your community or with whom you may share church or other services. It happens that families want to develop personal relationship. They want to invite you to birthday parties, weddings, etc. It can be challenging to explain to the families professional boundaries from the American perspective. From this quote, you can sense that the role of cultural broker is complicated in the sense that navigating community boundaries and or expectations is difficult. And also just the complexity of wearing multiple hats where you are in a community, but at the same time, attending to relationships that you may have with clients who live in the same community, which complicates how you exist within your own community wearing this hat of a cultural broker. Next one. Another challenge that was expressed is with regards to feeling a little bit of overwhelmed in terms of not feeling like you have control, so lack of control overall. this cultural broker expressed, the most challenging part of being cultural broker is that you are not in control of anything and anyone. The reality of the job is that it is difficult to feel grounded when there are so many moving parts to be considered to do your job. Parents, families, clinical team, community partners, the youth, all have needs and expectations for you. It can easily get overwhelming. So again, managing multiple expectations from different parties that you work with. Next slide.
Thank you, Bijou, again. Another challenge that cultural brokers have shared is really providing direct service in a dyad. So this person said, cultural brokers can be regarded by other providers as if they have a magical way to engage the families and tend to attribute more power to the cultural broker. So this is really talking about, I hear this all the time, cultural brokers saying, well, I'm having my own trouble engaging families in mental health services too. I don't have a magic solution, but it's really, we need time. I need time to kind of continue building and asking families to buy in what I'm offering. So I think sometimes that just, it's just highlighting how difficult this work is. Next one, please. Oh, actually, often, like another person said, often families and clients share information with cultural broker. How do I help them trust the systems? Again, it's really, this person is experiencing the frustration, right? That families, as great as it is for the families to trust the cultural brokers, right? They're having trouble of kind of like, how do we overcome of the families kind of trusting other people within the systems? Another person said, another cultural broker said, a clinician wants to know everything that was said, all the information. Yeah, I think that it's talking about the style difference, maybe cross-cultural communication difference. I wanted to say, yeah, all of it. And I think some of these questions and some of these challenges come up in the monthly cultural brokering call that I lead. And it is a safe place that we brainstorm some of these answers. Next, please. Yes, there are some rewards. There are some reasons why cultural brokers are still here with us. And one of them is, I think they see, someone said, it's my obligation to serve my community, right? Giving back and serving the community is part of their duty.
Thank you. As challenging as cultural broker role may be, many of the cultural brokers, and this is just a few of the rewards that were expressed, another outstanding reward is, making a difference in people's lives and just contributing to the wellness of youth and their families. And that was one of the common answers as well. Next slide. Another reward was expressed that centering everything we do around the well-being of children and youth is very purposeful work. It can help a selfless individual keep going. Again, it provides positive energy for someone to keep going regardless of the challenges that they may express. Next slide. That's you, Alicia.
Thank you. Thanks, Osab and Bijou, for representing the voices of cultural brokers. It's so kind of humbling and invaluable to be able to actually see the words and hear the words themselves. So as we've all witnessed, interpreters and cultural brokers are so needed, so cool, and the role is really invaluable to providing services to children and families. So our last bullet point was really about wanting to explore ways to contribute to a better system of care for ourselves, our colleagues, and ultimately our clients. And so we've been talking a lot about the individual interpreter, the individual cultural broker, and mental health clinician, and how they can work in partnership today already. But we recognize that individuals exist nested within multiple socio-ecological layers that all influence each other. So we're going to go through and talk about some recommendations at each of the different levels. So the individual among their peers with practices, service delivery practices, organizational policies, and then the professional community. I'll turn it to you, Osa.
Thank you. So what's on this slide really is recommendations for future cultural brokers, and the current cultural brokers, the comments or recommendation, it's from them. So one person said, communicate what you need for support within your agency and the external network to do your job well. We can all resonate that, right? What can clinicians do? Encourage your colleagues to communicate their needs. Clinicians and other individuals within the team can advocate for their colleagues, for the cultural brokers. Another cultural brokers said, continue to practice cultural humility and be open-minded. And the clinicians within the team can continue to practice our cultural humility, regularly practice a self-reflection of like, what am I doing, or what am I doing right, or what am I not doing, right? That kind of a thing. What am I doing right, and kind of continue that. It's not always wrong. Next. Another cultural broker said, our decisions have an impact on families, children, and the entire community. And this is really, it's talking about that immigrant community, right? We're thinking about not only me, we're thinking about, we're from a collectivism culture, so we're thinking about everyone in our community. So clinicians and others in the team can recognize different worldview, individual versus collectivism culture, being mindful that decisions are impactful to the whole community, take an active role in orienting cultural brokers about various American culture values and how they are ingrained in how they deliver services. And then peer support for cultural brokers by cultural clinicians, and then you. So you can form a support group, whether you want to be clinicians, cultural brokers, and bicultural, right? All of them to come together. Can you still hear me okay, Alicia, or others? My internet stayed unstable. Can people hear me fine?
Yeah, I can hear you now.
Yes. Okay, beautiful. Good. Right. Take the time to get to know others, such as taking a walk, debriefing about either a case or meetings that they have, just really trying to be mindful and creating that connection. Leaving a note of saying, I'm grateful to have you as a colleague, give a compliment or praise. And really, I think the summary of this slide is we all are busy. And I think there's this kind of like practice within institutions and cultures of like, go, right? And making sure we check off boxes and we do what we need to do. I think that's important, but I think the human connections and getting to know who our colleagues are, it's important, and kind of that self-care and slowing down. All right, we'll switch to best practice for the Cultural Brokers and Clinicians Partnership. I'll turn to Bijou to start the first one.
Beautiful, thank you. So, at this point, we should all be aware that, the purpose of partnering with cultural brokers is really to increase access and address barriers. The biggest challenge in this partnership is communication, cross-cultural communication to be specific. And it is critical to build agreed upon process on how you will deliver care as a team. It is important to have a plan that everyone understands and able to execute. Do not operate on assumption of who should do what and when. Rather, come together and create a working plan and regularly check in if it's working for everyone. So, some of these questions that we have on the slide is to address those questions in your team during your meetings and so on and so forth. So you can address, how do you introduce yourselves to the family or client or the community when you start working with them, and you can decide which one among you or how can both of you be introduced to the family that you're working with. You could also think of planning for the purpose of ensuring that you have a consistent communication, not just between of you, but also communicating to parents and families and the youth that you're working with. And I'll pass on to you, Gosa.
Thank you. Another important one is that a shared goal when delivering services. For example, I was involved in a case where a client missed over 100 days of schooling. And the goal for the clinician was to decrease the social anxiety that her client was experiencing at school. However, the cultural brokers view the issue as a behavioral and thought that the child needs a directed talk or what he called a real talk. And I think some of us know on the call when we say real talk, what that means, kind of like straight talk of you need to go to school, social, right? And not give an excuse to that behavior. So I think it's important, right? Different perspectives matters, and we welcome all perspective. But I think it's also important to kind of be on the same page of what is the goal. It's hard to move forward without kind of sharing that, what the goal is. Another one is, how do you prepare for and address issues that arise? Conflict and issues are part of life. What is the culture within the team for addressing issues? And I think that sometimes all of us, we might have our own style of how do we address issues or how we, reflect on what's happening. But I think the practice within the team and practice within institutions have a lot to do with how we do the work. If the institutions that I work with, there's no flexibility, or I'm not saying that's true for me. I'm just using a random example. But then if there is no flexibility within the team or within the organization of kind of friendly addressing issues, then it's hard for me as a cultural broker, as a clinician, to kind of create one, if that makes sense. And then the last one is, do we have built time for reflection and feedback? It's important to schedule a time after the meeting to reflect on our work and provide feedback. So Alicia was saying in the beginning how really important it is to have that either before meeting or after meeting. Before meeting to have a plan, and after meeting to really make time for reflection. And what do you do? Sometimes, right, two people can be in the same meeting. And then I noticed a lot of nonverbal communication, and I was able to kind of tell what was happening, where the other person was more paying attention to the verbal communication. So I think it's important to kind of like make time for that. Next slide, please.
Is that my slide?
Mm-hmm. Yes, sorry.
So we are transitioning to also provide voices of cultural brokers specific to addressing systems and policies. At a systemic level, both structure and policies, cultural brokers are expressing the need for adequate supervision, training, and support for growth. They're also asking that the role of cultural broker be integrated in service. So to be a normalized role, not just an external role, that comes in when there's funding and goes out the door when there's no funding. It's been also expressed to provide recognition for cultural brokering expertise, as well as building retention mechanisms beyond our traditional mechanism of retention, at workers, but also addressing organizational stressors that could hinder someone's ability to work well, and be mindful of the existing inequalities and discriminatory policies and practices. Next slide.
Thank you, Bijou. Great. So now we are at the larger circle in our socio-ecological map that we had. And we're really going to be talking about the professional community, values, expectations, and advocacy. So like we've been hearing really throughout here, mental health clinicians, interpreters, cultural brokers, and I would say management, everybody is really important and invaluable to closing the gap of the provision of trauma-informed and culturally relevant services to culturally, ethnically, and diverse vulnerable children and families. All of us are. It's all of our job. And so now we draw on this curriculum attending to secondary traumatic stress as providing some opportunities for us to build a better system just to be thinking about. So some of the stuff is not in our control based on our role, but it's good to have these in our pockets and in our understanding so that we can advocate for ourselves, our colleagues, and ultimately for better care for our clients. So some of the kind of recommendations to prevent burnout, vicarious trauma, secondary trauma, things like that, and to promote resilience and compassion satisfaction really relate to what Osab and Bijou also highlighted. Like, remember that interpreter and culture brokers are part of our workforce, right? We're all frontline workers. And so we need to celebrate those shining moments. So highlight the positives, right? The wins that occur, acknowledge them on your teams with each other. You could do this just in a meeting, or you could do it through your organization, like through a widespread news, right? You really want to maintain positive focus on the organization's core mission. You want to be able to say, like, we value raising the standard of care for refugee and immigrant youth. And by doing so, we are attentive to the needs of interpreters and cultural brokers, right? Convene optional informal gatherings after crisis events. So if there's something that happens in the community, particularly if the cultural broker has an ear to what's happening in the community and there's a death or a birth of a loved one or whatever, like, hold informal gatherings, let people know what happens in the community impacts community members. And it's really good that we're all a part of that. Encourage organizations to provide resources for staff to implement healthy coping strategies, right? To deal with the psychological demands of the job. So do wellness groups or reflective practice, provide reflective supervision, right? Then also build community, right? By providing space and time and resources for staff to connect and reflect together. Intentionally provide opportunities of connection and mentorship to new staff, including cultural brokers and interpreters and clinicians in that. Encourage that strong peer support among staff, like Osab gave us a whole bunch of recommendations for that earlier. And then finally, I would say convey a sense of hope. So convey a sense of hope and believe in the possibility of healing and recovery and growth in the face of adversity, trauma, and loss, particularly given, kind of everything that's happening with us today, right? We should model this sense of hope when we're talking with families, with children, with our colleagues, right? We want to walk arm in arm together and speak to each other and just resonate this sense of hope. So now we're coming to the end. So now we have a call to action. So we want you to do some self-reflection. We want to kind of push the envelope in your organizations a little bit. So after hearing everything that we've heard today, what kind of adjustments do you think you need to make as clinicians, mental health providers, interpreters, cultural brokers, management to better your system of care that you work in? Thank you. And we'll open it up for questions and comments now.
Great. Thank you so much, Alicia and Osab and Bijou. And another shout out to all of the cultural brokers who helped, and brought their voices to this presentation. It was incredibly powerful and we're grateful for that. So we did have some questions and comments come through the chat, both for everyone and privately to me. So I appreciate those. I would like to raise some of those. The first question I would like to raise is about, it was a comment, the examples shared are really helpful. What happens when a cultural broker and a clinician disagree on a plan? There's sort of an acknowledgement that sometimes cultural norms are really different than how we think about Western ways of learning, think about human development. So what happens? And I think that's for anyone on this panel.
Sure, I can start that off. I think it's important to take a step back and to remember this is about the client, right? And not to personalize the different opinions that's coming. But I also think it's also, for me at least, the way my brain works is like I like to take problems apart. So is this the clinical issues that we're talking about, or kind of a cultural issues factors? And if it's a clinical issues, I think depends. If there are safety concerns, I would say the clinicians have the trainings and the experience of kind of like really making that clinical call and decision. And considering if there are safety issues, right? If it's about a lot of cultural factors, cultural difference, I would say lean into the cultural brokers or community partnerships voice and making a decision. I also, you can bring another voice to kind of add, to consult with. That's one thing to consider. Another one is that whatever you decide together, cultural brokers, clinicians, is this a plan that is suitable, that will work for the clients and the family? And I think you guys can decide the answer. If it's yes, then go for it, regardless of what the disagreement is. And if it's no, I think that's probably a good time to slow down and bring another voice to consult. I'll turn to my other co-presenters in case they wanted to add something.
That's an appropriate question given the work, or the nature of the work, I should say. And it's to be expected, because cross-cultural communication is one of the biggest challenges in working in partnership. Like Osab said, I think communicating what's the plan for, and did you establish the plan together? Did you talk about it? What's your understanding of the plan? And providing education. Why is this plan in place, and how will it address the goals that have been discussed for the client and with the families? So I think a lot of it has to do with expecting that this disagreement will happen, but when they happen, what do we do? What's the plan for that? And creating that environment to discuss, and then be able to help you figure out how to best present it to the families and the clients. I hope that's helpful.
I don't know if I can add any more to that brilliance that was just said, except for what we really encourage is to build an authentic and trusting partnership between the mental health clinician and the cultural broker. And that's hard. That takes time, right? And we need to not take that for granted. And so really kind of sorting out, I think, where does that difference come from? Ultimately, if there's a clinical issue that needs to be handled by the licensed clinician or supervisor, but really like walk into that difference, right? Really try to unpack it yourself as a dyad, because then you'll be better suited to describe that to the family as well.
I also want to add that cultural broker and clinician is the best place to learn all these challenges that we're talking about. Like, there's no academic preparation that can prepare you to a lot of the conversations and issues that will come up. So take advantage to really learn from one another and issues that are coming up from clients. Thanks.
Thank you all. I want to switch gears for a minute and then maybe come back to this if that feels okay, if we can sort of flow with the flexibility. This is a really interesting and important question that we hear a lot. So, you know, when we provide mental health services and medical services, we think of HIPAA, right? The protection of private information. Can you talk a little bit about HIPAA within the role of a cultural broker, given that cultural brokers are community members, they're seeing clients in and out of sessions and interactions? I'm just wondering how you manage that. Maybe Osab and Bijou, you could jump in there to start.
I was about to say Alicia can take the lead on that one.
Or Alicia, whoever. I didn't mean to call anyone out, but
no problem. Alicia, do you want to start, and then happy to add?
Sure.
Make sure there's equal voice happening in here.
That's right. And I don't want to always be following up, you know, like I don't want to take the lead, but I want to be partners with you all. So what I would say is, when we're really thinking about cultural brokers, this is like the hardest role ever, because you have to balance those boundaries, and that's really tough. And so cultural brokers learn about HIPAA through clinical supervision. They have to be very transparent with clients, right? This is what I can say. This is what I can't say. I'm going to be out in the public ignoring you, like that type of stuff that can feel really culturally off-putting for, I don't know. I can remember, like, oftentimes, like, I can remember consulting to a team where there was like 3 families who lived right next to each other, right, who were all receiving services by that cultural broker, and the dance that cultural broker had to do, acknowledging, I am seeing all of you, but that doesn't mean I'm going to tell any of you what's happening, right? Like, I'm working with all of you, and being very clear and transparent about what can be shared and what can't be, citing examples as well.
Absolutely. I think it's an honor to really be part of the community and be serving that community. I think that trainings, like cultural brokers seeking out trainings that's happening related to HIPAA, or really trainings within the institutions that can expand their knowledge on the issues of confidentiality, going to whether it's an individual supervision or group supervision, coming to the cultural brokering monthly call if you can. I think all of this really kind of been on this path of learning, right? None of us stop learning. So I would say, I remember about 15 years ago when I was new to the work, I was at a grocery store, a local grocery store, like an ethnic grocery store. And I was literally trying to hide from like family members that I was working with. I was like, I don't want to explore any answers. I don't want to answer questions. I was literally hiding. And then I still think about it. I was like, well, that's not the solution. Like, my community, I'm feeling proud that I'm part of the community, just serving, right? But there has to be a way. So I think with learning over time, you kind of figure out and learn and navigate of like, how do I protect the people's confidentiality at the same time, just enjoy the weddings, whatever that's taking place, the festival, right? So that's my answer for now.
Confidentiality is huge, especially when you live and in close proximity with the community you serve. It's difficult, let's be honest. Like everything else, when it happens, what do? It's part of that planning and creating a place to talk about difficult conversation, I should say. But I think it's also important to know what kind of training your cultural broker has had, because that tells you the level of preparedness in understanding the mental health system, and also what's required of you as a clinician, and also how does that translate to them in doing their work. And also checking in with one another. How does this translate into the work you're doing, knowing that personal relationships are involved, knowing that next day you may run into a client on a corner. I think it's also important to communicate with clients that this is why I do what I do. It's to protect your privacy. It's understandable in a community that when you meet, you can talk about all kinds of things, but in this particular relationship, I have to honor that. And it's nice to communicate to clients as well. Thanks.
Thank you. I think we might have time, probably one more. We're gonna land on one more question. And like I said, it flows between what you were all just speaking about and the question before that. But so much of what we've heard is the need for cross-cultural communication, for there to be equal partnership between a clinician, a cultural broker, and interpreter. And so I would love to hear any kind of strategies or tips you have to help facilitate that, to help that feel more confident and like you're on equal footing as these two really important roles in this complicated medical system that we live in. So I'll leave that to anyone to start.
Amy, I want to make sure I understand. Is the question more specifically how do you strengthen that, or the clinicians and cultural broker?
Yeah, how to strengthen tips or tricks to strengthen that cross-cultural communication, as that really feels like the foundation of creating plans, for clients moving forward, making sure folks from different opinions and different backgrounds are on the same page to move forward.
Great question. Great question. Thank you. I can start. I think it's important to for clinicians and cultural brokers to understand each other's kind of cross-cultural differences, style, preference. For example, I think one big one for a lot of people, including myself, is time. So in the Western, I'm trying not to smile, but it's a problem. In the Western cultures, right, time is fixed. Meeting starts at 9 o'clock. People are there at 8:59, sometimes 8:55, right? Some other cultures, time is flexible. And it's not really, right? So time is flexible, and that, like, if I get there at 9:15, that's not that much of a, I won't get into too much about it, but I think there is that flexibility and understanding of where the other person's lateness is coming from. It's not because of our disrespect to where the members in the meeting, that there's just that there's difference. And I think it's important to create that space for the difference. Another one I think is active listening. I think I would say a lot of Americans, Western practice, people take turns, right, when they talk with each other. To me, that seems sometimes too formal. Depends on where I am. But in some other cultures, people talk over each other. In my culture, people talk over each other. But that doesn't always mean a bad thing, or doesn't mean I don't respect the other person's voice. That's just how different it is. So I think it's important to kind of like understanding where it's coming from, and is there space for both to function? I'm not saying one is good or one is bad. I think they're both important. I think really, if we continue to work on this, the partnership between clinicians, interpreters, and cultural brokers is crucial, because it really improves the delivery of services. And really, it creates that, like, we're modeling for families that we serve and we work for, or we work with.
I'm just gonna, go ahead, Bijou.
I'll be quick. I think in a perfect world, we wouldn't be doing this work if we didn't have issues of cross-cultural communication. And speaking for clinicians or doctors or social workers, none of us would choose to, yes, I can have an extra person as I deliver service to my client. In Western, we are used to, it's me and my client. It's almost like God and the person, just the two of you doing what you need to do. But the reality is that based on the multiple cultures that we work with, it's not the best interest of the client, and we have to acknowledge that. So I think the best thing is to ask for clarity when misunderstanding arises. If something happens, what's going on, and how can we resolve this so we can provide the care that's needed for client? And also just remembering that you are both there to provide care to the client and to not take anything personally, and just learn from one another to enhance your ability to provide services.
Yeah, that's so awesome. I was going to say something really superficial and just say, like, let's get to know yourself, reflect on yourself, and understand kind of where you're coming from, so that you can understand where somebody else is coming from, and create those opportunities to do cross-cultural things, right? Like eat different foods, go to a different neighborhood, go outside of your beaten path a little bit, to increase your own understanding so that you can create more space for understanding others.
Thank you all. Any final thoughts before I sort of close us out from our three presenters?
I just will keep it really quick and simple and say thank you to all the cultural brokers that are here today who contributed to the presentation. I think you matter, and the communities are so lucky to have you, and we're lucky to be working together. So thank you. And thanks to my co-presenters.
Definitely just expressing gratitude and the shared expertise and learning. That's all we're here for. Thank you.
Thank you all. Thanks for all of you who joined us. It's been a really incredible hour and a half. So as a reminder, in the coming days, you'll be receiving an email with a copy of the slides, a link to this recording, information about CEUs, as well as the links that I shared in the chat, so everyone has access to those. Please join us again on Monday, July 25th at noon Eastern for a presentation on parenting in a new context. It's going to be a very exciting presentation. Again, something that we get a lot of requests for at the center, so we're really excited to be able to offer this. Invitations to register for this session will be coming out in a week or so, so please stay tuned. You definitely don't want to miss it. If you have any questions in the meantime, feel free to reach out to my email, and OSAB's email is there provided. Please reach out. We're happy to connect. We're really happy to have you as a part of this presentation and this community who is really working to raise the standard of care for youth and families who've experienced trauma. So thank you. We'll hopefully see you in a month. Take care. Enjoy the rest of your day.